Hello, this is Ashlyn, and I'm reporting my slides for Team 1's presentation on psychological disorders. I had slides 4 and 7. So starting off with slide 4, it is titled The Major Disorders, and I thought this was important just to show exactly how many people are affected by these psychological disorders. So 1 out of every 5 adults experience some form of mental illness, and this is over 47.6 million people. And not only that, but 1 out of every 25 suffer from some form of serious mental disorder, things like schizophrenia, bipolar disorder, or major depressive disorder. By far, the largest one that affects people is anxiety-related disorders. Now, that's a large umbrella. Things like panic disorders, specific phobias, social anxiety, generalized anxiety, all fit in that boat, and that's why it has such a large impact. Over 40 million people are affected by anxiety-related disorders. Another large one is post-traumatic stress disorder, and this affects over 7.7 million people. Another one is major depressive disorder, and this affects over 16 million people. A point I wanted to make about major depressive disorders is almost half the people who are diagnosed with some form of anxiety-related disorder also get diagnosed with some form of depressive disorder. Another point is the quality of life of people with psychological disorders are generally lower, which is a pretty bold statement, but things like substance abuse is really common with people with psychological disorders, lower levels of education, higher levels of unemployment, and a very high level of self-stigma are reported in people with psychological disorders. So my next slide is number 7, and this is on schizophrenia. So the definition I put for schizophrenia is an abnormal view of reality. Now, what does that mean? Well, first, what is affected by it? So the dopamine and D4 receptors in your brain, when they're in abundance, this is what causes schizophrenia. Another part of the brain that plays a huge role in schizophrenia is the amygdala, and this has a big part in playing with hallucinations. It makes them seem real, makes them actually seem like they're there. So over 3.2 million Americans are affected by schizophrenia, and 40% of those cases have gone untreated, mostly for homeless people or people who are scared to get treatment, but 40% is a really high number. And most people are diagnosed between the ages of 16 to 25, so pretty young. There's 2 types of symptoms for people with schizophrenia. There's positive symptoms and negative symptoms. Positive symptoms are things that you gain while you have schizophrenia, things that you wouldn't normally have. And negative symptoms are the opposite, things that normal people have or you normally would experience, but you begin to lose as you have schizophrenia. So some examples of positive symptoms are hallucinations, seeing, hearing, feeling things that aren't real, delusions, which are false beliefs in reality, disorganized thinking, disorganized speech. There's a term called word salad, which is used for people with schizophrenia a lot. And this is when they jumble words together and it sounds like a word salad. It doesn't make any coherent sense. And this is because their brain is really disorganized. So abnormal motor skills is another positive symptom. People lose control of motor functions with schizophrenia, and an altered sense of yourself. You have a hard time seeing yourself for who you really are. So some negative symptoms. Again, these are things that you lose once you have schizophrenia. A big one is the flat effect. People with schizophrenia have a way harder time expressing emotions with their face, and it's the flat effect. It looks like their face is flat, emotionless. Avolition, which means no motivation. They don't want to do anything. Alogia, less speaking. They speak to less people and a lot less social. Anhedonia, this means less enjoyment, things that normal people would find enjoyable. People with schizophrenia might not enjoy it at all. And catatonia, they physically move a lot less. So moving on, there are 2 types of schizophrenia, acute and chronic schizophrenia. Acute schizophrenia is usually developed over a very short period of time due to some stressful event. But a good thing about that is it is a lot easier to recover from it. Now, chronic schizophrenia, this is when it develops over time, and a lot of the negative symptoms start appearing first, and it eventually develops into full-blown schizophrenia, and it is a lot harder to recover from chronic schizophrenia. That's why one of the best treatments for schizophrenia is an early intervention. Finding help at the earlier stages before it gets bad can play a huge role in their lives. So there is no cure. It requires lifelong treatment. And as I said, early intervention is a huge help for people who have it. So what are some of the things that cause it? Genetics plays a huge role. It can be passed down through genes. So sometimes in bloodlines or in a family, it's possible for multiple people to have schizophrenia. As I said earlier, brain chemistry plays a huge role in it, whether that is because of genetics or because of psychedelic and psychoactive substances affecting the brain. Changes in your brain chemistry play pretty much the whole role in having schizophrenia. So, quality of life. People with schizophrenia, for the most part, I don't want to say everyone, but for the most part, also deal with things like depression and social anxiety because of the self-stigma they have about themselves. They have avoidance tendencies, they isolate themselves, they have way lower levels of education, high levels of unemployment, usually have low self-esteems, and it's really common to see them abuse substances and have suicidal tendencies. So, some forms of treatment. Antipsychotics is a good medicine that a lot of people with schizophrenia take. Also, psychotherapy and psychosocial therapy are really helpful, especially psychosocial therapy, especially group therapy, because you want to have them in social interaction. You want to get them out of the house, make sure they're talking to people and trying to live some form of a normal life. And a lot of the techniques used to prevent self-abuse and substance abuse are also used to help people with schizophrenia, because these things also affect people with schizophrenia a lot. So those were my 2 slides of the presentation. I will also be emailing the full presentation along with this video, so you can look over the slides while you watch the video and my group members' videos. Thanks for your time.